7 danger signs and symptoms in the eye that should never and never be ignored. I'm still that your brother and your friend Stephen Oluwatumininu, and first of the sign that we shall be discussing is noticing discharge in the eye. Discharge in the eye is just like when a wound is producing pus. It is not something that should never be ignored. A woman was presented to my clinic with a 6-week-old baby complaining of unable to perceive light, that when light is being shined in her eyes, she wouldn't even respond or even blink the eyelids. I now asked her, for where did you deliver? Was it in the hospital? She said no, that her delivery was taken by traditional birth attendants. Then on examination of the eye, I now noticed that the eye has been discharging for a while. I now ask her, when you notice that this eye has been discharging, why don't you go to the hospital? She responded that people were saying the eye is developing, that the baby is trying to open her eyes, like Yoruba people will say, "Omon laju," and that was how she left the baby until when the baby can no longer perceive light. The most painful aspect of this is the baby has lost the 2 eyes as a result of endophthalmitis, which is total inflammation of the eyeball, which is secondary to the discharge that has been occurring, meaning the baby must have been suffering from ophthalmia neonatorium that do occur when a new baby is being given birth to, meaning the woman or the mother must have been suffering from either gonorrhea or one of these STDs, sexually transmitted diseases, that during the birth of the baby, now normal delivery, the baby passed through the normal canal and use eye to contact all these infections, and we call it ophthalmia neonatorium. That must have been the condition of this baby, which should have been adequately taken care of. I did mean she visited the nearby eye specialist or hospital, but instead she left the baby and the baby lost the 2 eyes. All these are the consequence of noticing some deadly or danger signs and symptoms in the eye and ignore them without taking a prompt treatment. Another one that we shall be talking about after discharge in the eye is peripheral loss of vision. Peripheral loss of vision, it do occur in cases like glaucoma, and the most deadly aspect of glaucoma is any damage done by glaucoma is irreversible. How will you now know whether you are losing your vision peripherally? Like I said in my past video, when you fix your eye at a point that is straight in front of you, try to fix your eye at a point, then you raise your 2 ends. You can be holding an object in your 2 ends, starting from the side of your 2 ears, then begin to extend that your end until your 2 ends are fully stretched. Then by fixing your eye at a point without necessarily turning to the right or the left, you should be able to see those 2 objects that you hold in your 2 ends when those 2 ends are fully stretched. If you cannot see any of these objects, you can now begin to bring your hands gradually to the front, gradually until when you can able to see. When you cannot see, when you are holding those 2 objects, when your hands are fully straight, definitely it means you are losing your peripheral vision gradually. So when you notice any of such, please, without hesitation, just try to visit a nearby eye specialist or hospital for adequate treatment. Another one that we shall be talking about these signs and symptoms that are very dangerous to the eye, is eye redness. Eye redness, so many people usually take it for granted because they think it's a normal thing. Irrespective of what might be the cause of this eye redness, either as a result of trauma, either as a result of allergy or infection, it is not something that should never and never be ignored. Why now? If you leave eye redness and you don't take adequate care when you're supposed to take care of it, you to graduate to discharging. When the eye started to discharge, like I told you, it's just like when a wound is producing pus. So when you left it without being taken care of, it will graduate to endophthalmitis, which is infection of the total eyeball, which easily results into blindness. All these signs should never and never be taken for granted. Another one that we shall be talking about the danger signs and symptoms in the eye. The fourth one is when you start noticing flashes of the light. Flashes of light or floaters in your field of vision. It is very, very dangerous and it should never be underemphasized. Flashes of light or noticing flashes of light or noticing a kind of floaters in your field of vision, it occurs in cases like vitreous detachment, vitreous hemorrhage, or retina detachment. And all these eye conditions are very, very dangerous to the eye. It easily results into blindness and it should never, never be taken for granted. Another one that we shall be talking about, blurring vision. When you start noticing blurring of your vision or diplopia, which is double vision, it is high time you contact the nearby eye specialist or you go to the nearby hospital, lay your complaint and let adequate treatment be given to you, because all this can never and never be taken for granted. Now, in what conditions can you start noticing either cloudiness of your vision or blurring of your vision? When you start noticing, like you're looking at the environment and it looks smoky, or when you start noticing cloudiness in your field of vision, it occurs in cases like cataract. Cases of cataract, you begin to notice such things like that, and in so other cases. So when you notice any of such, please visit the nearby eye specialist or the nearby hospital for adequate and prompt treatment. Another one that we shall be talking about is pain. Pain is something that should never and never be endured in the eye. When you start noticing pain, please don't take it for granted. Pain occurs in conditions like corneal abrasion, corneal ulcer, migraine, glaucoma, and so many deadly eye diseases. And one thing about corneal ulcer that produces a very intense pain is the corneal ulcer will usually end or heal with a scar. And remember, light doesn't pass through an opaque medium, and moment scar happen to your cornea, especially at the pupillary region, what simply it means is blindness. You won't be able to see with that eye, and that is why the little signs and symptoms that we might be seeing in our eyes or taken for granted should be well taken care of and demand immediate attention, meaning it should never be ignored. Visit the nearby hospital or the nearby specialist to take a prompt and adequate treatment when you notice any of all the signs and symptoms we've discussing. The last but not the least is sudden or gradual loss of vision. The other one we talked about loss of peripheral vision, but now sudden or gradual loss of your total vision, which occur in cases like cataract, in cases like glaucoma, in cases like diabetic retinopathy. All these are cases in which you can start noticing sudden or gradual loss of vision. Sudden loss of vision occurs in cases like retinal detachment, stroke, and so many other conditions. So noticing any of these signs and symptoms is not something to be ignored, but it is high time for you to rise up, visit your nearby eye specialist or to the hospital to take adequate and prompt treatment. Because I usually tell you that the best prognosis, the better prognosis is when an eye disorder is early detected and promptly treated. That's what will give you a probable or better prognosis. Now, let me now tell you, prevention is better and cheaper to cure. Please don't let us don't let us make all these things, don't let us take it for granted. Don't let us ignore all the signs and symptoms that we've discussed so far. Please let us take proper attention. Let us take all these things very, very serious. When we are noticing any of such, let's go to the nearby eye specialist or hospital for proper consultation, adequate diagnosis, and prompt treatment. If you've benefited from this my video, please kindly press the subscription button, like, share, and even comment. When you make any comment, either you want more explanation on those things that we've discussed so far, I will respond as quickly as possible to your comment. I will respond to you, I will answer you. So without hesitation, please subscribe to have more access to my educative videos. Please subscribe, like, and share my video, and don't remember to make your comments. And likewise, don't remember to go to Stephen Oluwatumininu on YouTube. You see many informative videos are there for you to watch. Like there's a video I released there, like testing your vision at home without necessarily going to the hospital. Here There in that video, I was able to talk at length concerning how you should be able to check your peripheral vision, what it entails, and other types of vision that you need to check without going to the hospital. All these things are there for you, and God bless you as you watch. So don't hesitate to like my video, subscribe, share, and make your comment, and watch my video at Stephen Oluwatumininu on YouTube. God bless you as you do so.